All right, so as we're looking at this chest x-ray, what really catches my eye is the shift of the mediastinum to the right. That's a big clue that there's some volume loss happening on that side. And then those pleural calcifications, especially on the right, are pretty hard to miss. They're definitely pointing towards something chronic. When I zoom in on the lungs, I'm seeing signs of bronchiectasis in the lower zones, particularly on the right side, and there's some patchy opacification at the top of both lungs too. All of these findings together are really making me think of old, treated tuberculosis. You know, the kind that leaves behind scarring and calcifications just like we're seeing here. So, why am I leaning towards tuberculosis? Well, those pleural calcifications and the scarring pattern are kind of classic for someone who's had TB in the past and got treated for it. But we can't just stop there. We've got to think about whether something new is going on, like a fresh infection or maybe even a cancer that's sneaking up on us, especially with a history like this. Given everything we're seeing, I definitely recommend getting a CT scan of the chest next. That's going to give us a much better look and help us figure out if we're dealing with just old scarring or if there's something active, like a new infection, or fingers crossed, not a tumor. It might also be a good idea to do some sputum cultures or maybe even a bronchoalveolar lavage, just to make sure we're not missing any active tuberculosis or other infections. And hey, a follow-up chest x-ray in a few weeks wouldn't hurt either, just to make sure nothing's developing slowly in the background. If it turns out this is just post-tuberculosis lung disease with nothing new going on, the plan is pretty straightforward. Supportive care, maybe some pulmonary rehab, and just keeping an eye out for any infections that could pop up. But if there's any sign of active tuberculosis, we've got to jump on that with isolation and treatment right away. Now, I'm thinking about what the examiner might throw at me next. Maybe something like, what if this patient wasn't intubated? How would that change your thinking? Well, I'd still be thinking about tuberculosis, but I'd also be asking about symptoms like a persistent cough, coughing up blood, or any weight loss, anything that might suggest the TB is back in action, or even something more serious like cancer. If cancer was on my radar, I'd be looking for signs like a mass on the CT scan, or maybe a history of smoking that could point in that direction. And in that case, a biopsy might be the next step. And we can't forget, reactivation of tuberculosis is always on the table. It could do more damage to the lungs, and we've got to think about the public health side of things too, especially if this patient's around others who might be at risk. So managing that carefully is key. So there you have it, a complete breakdown of the case, thinking through all the possibilities and how to manage them, all while keeping things relaxed and confident. If you enjoyed this walkthrough, don't forget to hit that subscribe button, leave a comment, and let me know what you think. Also, share this with anyone who might find it helpful. And as always, keep learning and stay curious. See you in the next video on Radiology Made Easy.